Welcome to the Rehab Links Secrets to Success podcast. I'm your host, Lisa Chase, and I would love to welcome Dr. Karena Wu to our show. Welcome, Karena.
Thank you for having me.
Excellent to see you. So Karena and I met. I was looking back actually through my phone. I'm like, what year did we meet that we did the pro volleyball? And it was back in 2015.
Yes, it was. In fact, when I was working on a last tournament, I found something and I was like, oh my God, that's when Lisa was there. It was back when I was working with Spider Tech too.
Yes, and yeah, exactly. You were working for Spider Tech because I remember you were doing a lot of instruction on how to use the tape with the athletes. So yeah, so that's kind of when you and I connected, and you have a wealth of knowledge. A specialist in orthopedic, sports medicine, and manual therapy. Obviously, the director of the AVP, Pro Volleyball Tour. And you have two clinics, and you're in a super busy clinician, right? So you have a clinic in New York called ActiveCare, and then also one in Mumbai, India, which I don't think you and I have actually talked about in detail. So I want to hear a little bit more of that story. And then you also have many, many appearances on TV. You're like the physical therapy star of TV, being on Dr. Oz, CNN, and all sorts of different shows. So looking forward to kind of hearing what you have to share with our viewers. But why don't you just talk a little bit about kind of, your background, your journey, how you kind of got to where you are today?
Sure. So I'm originally from Los Angeles, California. I visited New York, fell in love with it, applied to school, got into school, and was like, I am out of LA. So I've been practicing for 23 years in New York City. I've always been in a private practice setting, interestingly enough, where I was the only PT. And it kind of went along with my personality because I'm such an independent person, probably a little too much. And it was fine. I would always do my self-studies and self-research. And I would work in my first practice, I worked with chiropractors. And then subsequently, it was just a PT clinic where we were ships passing in the night if there was someone in the evening. Like I'd be the full-timer and then there'd be a part-timer, but we never crossed paths really. And my background, I've gravitated towards the Maitland Australian approach. Mm-hmm. When I first took a course, it reminded me of the joint modes I learned at Columbia. And so it just, I don't know, it just clicked. And I was like, oh, this is easy. I could do this. And in 2000, I graduated in 2000, but in 2001 is when I started my extensive coursework. Like I'm a sponge. I love to learn. And I did tons of courses in Maitland. I did myofascial stuff. And now it's progressed onto all the IA stim, cupping. I'm now faculty on Maitland. Queen of kinesiology tape, especially when working the AVP medical tent, which is kind of fun. And what else do we do? I mean, I constantly learning.
Yeah, absolutely. So now you've got two clinics. So talk a little bit about, your clinical practice, both in New York and in India, and how often you go there and why you decided to open up a clinic in India.
So they're kind of like sister clinics. The reason that came about is because an old employee who was Indian was moving back and she said, I don't want to stop working for you. And I was like, don't know how that's going to be possible because I'd have to own something. So I went over there, I did my due diligence, did some market research in Mumbai, went to Saudi Arabia, went to Dubai and looked in the region and found that there was a really good need for high quality advanced manual therapies. I've also had a lot of international PTs work in my New York City practice. I've had Thai, South Korean, Filipino, Egyptian, Polish. What else have we had? Oh my gosh, so many different, and then tons of Indians. And what I found was they didn't have the best manual therapy skills. They were a little heavy-handed, not a lot of conversation with the patient. They just do something and then get them up. And that's how that practice came into being. So our practice here is a boutique. We are a freestanding clinic still in a world of corporate PT now.
Yep.
And we do all concierge type of treatment. So it's all one-on-one, and we specialize in manual therapy as well as a holistic practice philosophy. So we look at the whole body, and when someone comes in for an injury, we are starting distant, not local. So meaning if you had a shoulder injury, I'm not just going to your shoulder. I'm looking at the whole kinetic chain. And then when we actually start treating, we start down in the lumbopelvic region, into the thoracic spine, everything that feeds into that area. And then we will show the patient that there is change when we affect the entire system.
Yes.
So that's how both of the offices work. It's the advanced manual therapy. We do Pilates-based rehab, sports and functional training, very little use of modalities. And that in India is a little bit more novel. So they have a growing population who are looking for better, because the way their system works is you used to go to PT every single day and you get tons of modalities and maybe like a little like rub like this.
Yeah.
Yeah, they're not so touchy-feely.
Yeah. Yeah. Well, yeah. And we have a, similar kind of practice. I think that's why we're always, you and I are always sharing things like, oh, hey, check out this product, or, something new that we're doing in our practice that we know, really, gives us those, great outcomes for our patients. So, so that leads me into my next question about, obviously you're treating very high level, high profile, whether it be athletes, celebrities, and a variety of different things. So you need to get great outcomes, right? So with all your experience, why don't you give our listeners like 3 really good, tips that you think, what helps you, what differentiates you from, and how do you get those great outcomes?
So, okay, I'm going to say things and they should just be standards, but one of them is truly listening to your patients and taking a very thorough evaluation and assessment. You should be able to give them a diagnosis, especially if you're taking insurance, for charting and documentation. But a lot of times people want to know like what their problem is.
Yep.
So really listening to them is crucial, because when you know what the underlying problem is, all the symptoms they have make sense. And so I'm going to fix the problem, which will affect the symptoms versus chasing their symptoms. That is one thing. And then the other thing will be hands-on. So appropriate hands-on, as I've said, and I was just talking to a person who wants to go to PT school. So, it's always fun when they're young and moldable and impressionable. When you appropriately treat with your hands, you're going to have better outcomes. And the longer I've been doing manual therapy, the more I found a bit of a softer touch has way more effect than just pummeling tissues, right? So again, you're always marrying what your base knowledge is. And this is, again, this Maitland concept. We have all been trained in PT and advanced skills in whatever. So you take all that book knowledge and then you have to apply it to your patient. So putting that together is really, really crucial. And then putting together an appropriate home exercise program is really crucial. Knowing when to progress them or when to back off. I just had a team meeting at 11 o'clock today we have 2 PT students here and then my other 2 PTs. And we were talking about discogenic pain in the lumbar spine. And I'm like, what exercise are you doing? And they're looking at me and they give me information about how they're trying to reduce the disc. And I'm like, yeah, but what exercises are you going to turn on so that all your treatment manually stays for longer in between sessions? And I'm like, if they have an extension bias, hint, hint, what are you going to turn on? And they're like, extensors? And I'm like, yes, would probably be a good idea to make their posture better. And whose posture needs extensor training? Everybody's, so having the appropriate exercise with follow-up is crucial. So that also there's a little tie-in of the therapist also knowing and remembering what they did with patients.
Yeah.
Because I've seen staff and heard of other clinicians sometimes not really remembering their patients.
Mm.
So I think that can also make a big difference and a bigger impact in how the patient can progress. You like really knowing them, what their life is like, and then what exercises you gave on the last visit versus having to check the chart.
Yeah, you hit on so many really good points. So, firstly, like the listening, I so agree with that. I always, when I'm teaching, especially younger students, or when I'm teaching like at Michigan State, I always say the mystery is in the history. And so if you know the right questions to ask and you listen to what the patient tells you, they will tell you what you need to know. And from there, you're just going to couple that with hands-on exam, and you're already from the history, you're already going to kind of know what's going on, and now I'm just going to confirm that probably with my hand. So I totally agree, that is really key. And then the exercise piece, that's another really crucial one. Either patients come in and they have a plethora of exercises, right, way too many, and none of it really makes sense. And what we do with our hands is so valuable, but it's not that valuable if you don't give them a follow-up home program that's going to help maintain your manual skills of what you just did with that patient. So then they can improve and continue to progress. So yeah, those are really, I resonate with all of those. And having, whether it be a good, I think you use WebPT, a good medical documentation system, obviously is helpful. And really knowing your patient, I think you said that, I think that's really important. And you got to meet people where they're at. For sometimes patients they're like, it's too many exercises. So maybe it's, adjusting, hey, well, let me meet you where you're at. Let's do 3 things that are going to improve your extension, like you were saying. So,
Yeah.
so using a good system definitely helps, so you can, know how to progress them next time.
Yeah, I mean, a lot of our business is word of mouth and return patients.
Yeah.
And if I get a patient back and I remember some aspect of their life, their kids, the trip they took or something, they're like, wow, you have such a good memory. And it's part of the reason why they come back, right? Like we develop such strong relationships with a lot of our patients and they turn into friends.
Yes.
But I always tell my staff, as I try to like up train them and make them want to be better, is I'm like, the difference between a great therapist and a good therapist is the details, the attention to details and knowing your patients. Because if you need to look in the EMR, in the case note to see why your patient's not in there, you obviously forgot about your patient. Like they're forgotten, and you put your hands all over them, you have their whole history there, and you can't remember where your patient is. That's like not great,
Yeah.
This is all about relationships.
It is. It's about relationships and honestly just showing that you care, and caring is knowing and building that relationship. So yeah, it's something I think, as that we're constantly teaching, right? Both of us run clinics, and as you bring new therapists on, it's teaching them, again, maybe they have the skill, but it's not just the manual skill, right? It's the relationship skill. So yeah,
100%.
those are great tips. So I know you do some teaching, obviously you work with patients and you do a lot of education. So what does your audience particularly appreciate, that you can share with our audience?
What do they about the teaching aspect, or
Yeah, whether it be about, the teaching, or something that, might even be your therapist. Your therapists are your audience. Like, what are they always saying, like, to you, that they really, appreciate that you do, or your particular way or method?
oh my gosh, that's a loaded question. I think they really, really like my attention to detail regarding the techniques. So I am now on Maitland as a faculty member, and I'm teaching Jeffrey Maitland's work. So his joint mobilizations really work for 80+% of the population. And when you get certified, you're not supposed to change it just because you feel like it and you kind of forgot how you are taught and how it's printed in the book. You're supposed to do it like how Jeff Maitland designed it, because it does work. And what I have found is that when I teach, especially peers, any staff member that I'm working with, and when I'm teaching students, when they are clean in their technique, and again, they sort of lighten their hand contact, which is a skill they're developing. But when they do the techniques as per how we're teaching them, it works like that. And they're like the awe that they have when it actually is applied correctly, and you can change a patient really fast. They're just like, wow. And I'm like, yeah. So why not just do it cleanly like that? Because if you're going to get certified, when you test, you should be doing it like how any of the instructors have taught you. And then again, in theory, you are not supposed to change it. One of the things I say about PT is that it's standardly unstandardized, because sometimes, and way too often, some therapists will like go attend a Con Ed course, learn it, and then they're doing it with different sort of handholds because they just forgot. And I don't know if they're being lazy and they don't check, or they're just like, it works for them. But if you're going to get certified, the point of, if I send you a patient in Florida, you should be able to do the MOBS assessment, relationship building, kind of similar to how we other Maitland therapists do it. Even through the American Academy of Orthopedic Manual Physical Therapists, AOMT, when they're looking for a FAOMT, right, a fellow of the American Academy, they're looking for therapists with a very specific skill set. And they want that higher level, more standardized skill set versus kind of like those one-offs sometimes when you don't know who exactly you're getting.
Yeah, so I agree. I teach, I come from the osteopathic background at Michigan State, and we teach a lot of students. And I think as therapists, we're constantly going out there and we're learning and we're learning and we're learning, but are we ever really mastering, right? And that's what you're talking about. You're talking about mastering a skill. So talk a little bit about that, just because I think that's so important, for any of the listeners who are practitioners, on what it takes to master a skill. So how have you mastered, because you have several that you've mastered, Maitland is one that you're talking about, but what do you do to help you master a skill so you could get really great outcomes?
10,000 hours or 10 years.
Yeah, baby. There's something to say about those 10,000 hours.
So, yeah, 10,000 hours, and yeah, I'm a master. No, I'm kidding. Constant learning. So as someone who grew up playing 11 years on the piano and in competition, ooh, I understand the discipline, with learning an art, a fine art, right? Yes. So same thing in your physical therapy practice. You have to practice it. You have to be open to constructive criticism back. You have to be open to being spot checked. Yes. I personally went into the fellowship late in the game at 16 years out of practice. And I specifically did it so that I could have someone looking over my shoulder to be like, you could do that better, or something like that. I was like, maybe I could do something better. I feel like I'm doing things well in my practice. I get good patient outcomes. I get great, relationships with patients. But let me humble myself and pay a lot of money and take a lot of time of restudying things and having a senior person over me check me. And I got checked. Let me tell you, it was not comfortable, right? But it makes you better. You have to be open to being put on the spotlight and being like, oh crap, what do I know? Am I actually right in this? Like for Maitland, again, I highlight them because it's the way that I practice, and it's very common sense and it makes sense. You're never wrong if you have a logical justification. Like if it's too far out there where no other therapist would do it, then you're like, yeah, that doesn't fly. Yeah. But if it stands to reason where you passed it by another therapist and they said, oh, yeah, sure, let's try that. And then it's the thing. There's no 100% only one way to treat a patient. You can come at it from different ways. And if it makes sense, it should probably work. So there's that, I'm a constant learner. Like I've taken a strengths assessment thing. Two of my things are input and learner. Yep. And it's so the case because I just reset myself back into studying something just recently. So
Another thing.
do I want to do this over the summer? But I like learning. It takes time. And it's an inherent quality of mine. I love learning and I love being a sponge. So I will sit here if I have forgotten about a test and I need a little refresher, I'm on Google. And I tell the young ones around me, I'm like, I did not have Google. I had Miggy's.
Right.
Google is so much freaking easier. Like
I know.
the younger people should never have a don't know, because I'm like, just Google it and come back to me, because that resource is invaluable.
Yes, that is so true. Well, it's funny because we did Strength Finders too, and Learners, one of my top 5. So the learning and growing, like never ending pursuit for growth and just constantly wanting to learn. I just think that is so critical. And then teaching, right? I know you teach, like you just said, you're teaching Maitland, I teach at Michigan State. Like when you have to teach this stuff, you also have to up your skills. You have to review, make sure you're really keen on how you're going to explain the technique, your hand placement, all of these things. So I think that also makes you better and better each time. So
yeah, and I mean, I'm in the phase right now because I just hired our last student, and she's a gem, but she's young.
yeah.
And I have another guy who's a little bit older who has never had someone over his shoulder to force him to be better. So he comes off a little bit like he's young. And I'm like, oh my God, how many conversations can I have? So I've taken the time out of my life to have up training sessions. We just did one on the weekend because it's only fair, I'm trying to make them better. And it requires feedback, it requires practice. And just constant, like, you got to want to be better. I don't want to shove this down your throat. If you are really keen on the information, I will give it to you, but then I expect you to practice, because if I come back to you and I ask you, so how's this mob doing, or how's this taping technique doing, and you haven't used it, you've forgotten it, why am I wasting my time, right? Like, it's an inherent skill set. People either really want to be better and are going to do better, and then put the time and work in, because it is work, but then you get the accolades later in life.
Absolutely. I mean, it's a total mindset. And like you said, I think it's just inherent. That's why, like, I really like the Strength Finder. We have all of our team do it. And, yeah, we do. And we actually do it as part of the hiring process, because we really, when we bring team members on, we want them to resonate with our core values, and then their strengths are suitable for our culture and for what we are trying to do in the practice. So yeah, I love the Strength Finder, and that, yeah, if you want to bring people on that really are truly those learners, they really want to grow. Because like you said, they're only going to get better if they really want to get better, right? We could be there to help guide and teach, but ultimately they have to have the desire. So yeah, I'm with you with that for sure.
Well, we're business owners, so right, we want someone who just naturally has that ambition and that drive. It's kind of disappointing sometimes when you have to financially incentivize it, because then there's also that, like, well, if I didn't have this, then are you going to leave me for someone who's going to pay you more, right? Or if you don't have the incentive for them, are they going to leave you? But or are they also now starting to fish around because they're literally financially incentivized?
Yeah, there certainly is that. I've really focused this past year on building culture and this inclusion, and that's been really cool to just see people kind of taking things on in a different way. So finding other ways that you can bring that engagement. So yeah, us as entrepreneurs and as business owners, we're constantly trying to learn and grow on how to help motivate our team, right? And bring the right people on. So I'm with you. All right. Is there anything else of value that you would like to share with our listeners? Yeah, any other, little things that you may have to share?
I would say for anyone who's a new graduate, take the time in the beginning, because when you're still fresh, it's easier to be a student and have that mindset of studying and learning and practicing, because sometimes when you're older, it's a bit harder to turn that aspect on in your brain. So, and then don't take it personally, you know. I've luckily not really had that issue with any staff person, especially as a clinician. But, you know, the elders, the older, wiser ones are always here to help guide them and make them better. It's nothing that puts them down. It's just, it's like your mother was always right, right? Like
Right.
they have the experience and they're like, because I've had that experience, that's why I can give you that feedback. So be open to constructive criticism. Don't take it personally. And if your mentors or those who are senior around you are suggestive of courses or things like that, it's probably for a good reason, because they can either see something in you where they think that that would be good for you, and or, you know, again, it's just like, I can tell this is where you need some work, so you need to take that time and practice it.
Yeah, I think that's you know, that's a really great tip. And I'd probably piggyback by saying, find a mentor, right? Like you, right? You know, you're a mentor to your younger, you know, your students that come through, your new staff members. And I'm sure you have mentors, right? I know I have mentors, but
No,
find
I
a
didn't.
mentor. Uh-huh. You
I
don't have
never had mentors.
You
No.
never had mentors? Oh God, mentors are great. Like I have business coaching mentors and, you know, physical therapy. You know, one of my big mentors just passed away, Mark Bookout, who him and I own Rehab Links. And he was just an amazing, you know, clinician in so many ways. And so, yeah, it's great. Like it's really great if you can have some mentors, you know, to kind of lean on. It certainly does help. So.
Yeah.
Well, this has been great to see you and to share your information. How can people find you if they want
So,
to learn more about you and your clinics? Yeah.
yep, our website is www.bestptnyc.com. The business name is ActiveCare Physical Therapy. We are on Instagram, Facebook, LinkedIn, Twitter, even. We produce a lot of video content with like little tips for our audience,
Yeah.
and we do a lot of like informative videos, really short, sort of clinically based types of things. And, you know, if anyone is interested in doing manual therapy in New York City, I'm always interested in meeting other peers who have that desire to do manual therapy, do Pilates-based rehab, really work one-on-one concierge, and be better.
Yes, that's awesome. Well, thank you so much for your time. I know you're a super busy lady, so it was awesome to see you. And yeah, I appreciate you.
Perfect. It was great to be able to speak and share my experience with you.
Excellent. Well, until next time, keep getting great outcomes.
Excellent. Thanks.
Thank you. All right, I'm like trying to find my little stop my recording.